I am Dr.G.P.V.Subbaiah, spine surgeon, Star Hospitals, Hyderabad. So, whiplash, all of you, whiplash injuries, it's a very common form of injury to the neck. What happens if you are traveling in a bus, or if you are traveling in a car, if there is a hit from behind, what happens, your neck goes into forward flexion and then the backward extension. So that is what we call a whiplash injury. Initially people may not have any pain in the neck, but afterwards they can have chronic neck pain, pain between the shoulder blades, pain over the shoulder area. So this is what is known as a whiplash injury. But the problem with the whiplash injury is, if you take the x-rays and if you take the MRI scans, we don't find anything special on the MRI. So it's all because of changes in the muscles, and when the research says there could be some changes in the ligaments. Ligaments are the supporting structures of the bone, or there could be some changes in the minor changes in the discs. Discs are nothing but a soft cushion-like structures between the two bones in the neck. So it's there from top to bottom, from neck down to the lower back. So the problem with whiplash is they have neck pain, not many changes on the X-rays and MRI scans. And the treatment, if you look at the treatment part of whiplash injuries, would be to put the patient on pain medication, what we call anti-inflammatory drugs. And some people are resistant to anti-inflammatory drugs, and for those patients we use what we call anti-neuropathic medications like pregabalin and gabapentin, and in some of the people we use some antidepressants also like amitriptyline and nortriptyline. So the medications, anti-inflammatory medications, anti-neuropathic medications and antidepressant medications. And in spite of these medicines, some people are resistant to the medical treatment. So for those patients, what we do is we give, if there are any trigger points. Trigger point is nothing but, say, if I press on a particular spot, if the patient has tenderness, pain on pressing, that is what we call a trigger point. So if the patient has a trigger point, then we give a steroid injection at that particular trigger point. This is what we call a trigger point injection. And then the rehabilitation part in these patients also is very, very important. So we need to strengthen the neck muscles, the muscles around the shoulders, the trapezius, the shoulder blade muscles, and the muscles around the shoulder. So medication, rehabilitation program, and if needed, the trigger point injections. So in spite of doing all these treatments, some people, even after doing all these treatments, some people do not respond to this kind of treatment. So for them, what we do is we put them to a clinical psychologist and we give them what we call cognitive behavioral therapy. So whiplash injury doesn't require any special surgical interventions. It has to be treated by medical treatment only, and the medicines, the rehabilitation part, and if needed the injection treatment, and finally if needed we give the patient some sort of cognitive behavioral therapy. Thank you.